Welcome back to this week's episode where we're going to discuss a little more about chronic pain and nervous system regulation and how important it is to regulate your nervous system if you have any sort of chronic pain. And this is tried, tested, and true in my clinical practice currently. You can have a severe, moderate, slight disc bulge to disc degeneration and absolutely no pain, but you can also have a completely normal MRI and be in debilitating pain. So one might ask, like, what's going on here? We've been taught to think pain as simply a tissue problem and or a structural problem only. Something is torn, something is inflamed, something is compressed, something needs an adjustment. And sometimes, yes, that may be true, especially in acute injuries and or sports injuries, things of that nature, but chronic pain works just slightly differently. And if we don't really understand why, we end up chasing structural abnormalities while ignoring the system. So, pain is not a direct measure of damage per se. Pain is an output of the brain and the nervous system that's telling you that something is going on here. Your nervous system is constantly scanning for a threat, whether that is physical, emotional, metabolic, inflammatory. It's continuously doing this scanning process where it's trying to detect danger, and it creates pain as a protection mechanism for you to pay attention to that area instead of ignoring it, instead of numbing it. This is a very intelligent part of your body. It's been derived from thousands of years of human adaptability and genetics. It's a very, very, very intelligent part of our body that knows when to fight, when to flight, when to fawn, when to freeze. And there is intelligence in this system that can't be ignored. In chronic pain, though, the system becomes sensitized. And that's what we call central sensitization. This lowers your pain threshold and the signals amplify because you might be ignoring it when it's still a little bit on the lower end. The alarm system becomes an overprotective mechanism instead of a regular protective mechanism. Now, a normal movement might feel threatening. Your body starts guarding more. The muscles feel a lot tighter, and any movement that you could have done before, the steps get shorter, your back gets stiffer, you're not able to walk as nicely anymore. You're stressed out at work or school, stress increases the pain, and then sleep disruption happens because of worsening symptoms. You're in pain while you're sleeping. And or if you're dealing with any sort of emotional turmoil, this can trigger flare-ups very, very often. And the tissue may have healed, but the nervous system is still on guard, is still stuck in this overprotective mechanism. And this is why structural fixes sometimes fail. People can do physio for months on ends and nothing changes. They're strengthening their core, they're doing daily stretch, they're getting massage, they're trying injections, they're getting nerve blocks and cortisone shots, and it might help for a week, maybe a two, sometimes not even that, and they can still be in a lot of pain. It's because you can't strengthen your way out of a dysregulated nervous system. If you're stuck in a sympathetic overdrive, go, 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 your sympathetic tone is super high, you're in flight or flight dominance, like that's your default setting, pain sensitivity increases an enormous amount. And this is something that even if you're not in pain, if you have any menstrual issues, if you have any digestive issues, if you have any skin issues, if you have, there's so many things that I'm teaching on almost every single one of my patients right now, nervous system regulation, because everybody that I treat so far, have treated so far, is in a sympathetic overdrive and they don't know how to shut off, like they don't know how to turn that off. When you're stuck in this sympathetic tone, your heart rate variability drops, your inflammatory signaling shifts, your body's having a harder time getting repairs done, resting, digesting properly. Your muscle guarding increases because you're on high alert, ready to run, fight, or figure out how to stay alive or survive. And from a traditional Chinese medicine lens, we might see what we call liver qi stagnation or blood stasis when you get the super sharp pain, super acute in a certain area in like your low back or whatever. All of this can also have an underlying qi or yin deficiency that is failing to anchor your nervous system properly. Yin is like the coolant energy in your body. So if think of like in an engine, you put a coolant in to like keep the engine nice and cool so it doesn't overheat. Same thing. Our body has that type of an energy also. So it's different language, but same patterning. Like the system is stuck in protection mode and then developed into overprotection mode instead of self-correcting and being able to default back into parasympathetic. So one might ask what actually helps in this. And the goal isn't to fix the muscle, it's to restore regulation in the body, to tell and teach the body that it is safe now. It might not have been when it started. When this pain started or how it started, but now we're trying to reteach the body that it is safe, doesn't need to be stuck in this sympathetic default setting. We're actually trying to down regulate it to the parasympathetic and teach the body that the parasympathetic is the default setting that we want. And then you can use the sympathetic as needed, not to be the ruling, oh my God, words, setting that your body's kind of stuck in. So when we're trying to restore the regulation, this means improving the vagal tone, staying in the parasympathetic zone, reducing the sympathetic overdrive, restoring safety signaling in your body, and addressing sleep, stress, and even supporting metabolic activity and stability in the body. And this is one of the many reasons, but one reason that acupuncture can be so powerful in people. It's not just needling tissue, it shifts the autonomic balance back into rest, digest, and repair. This helps modulate the inflammatory pathways so that the signaling can go back to being safety, and it influences central pain processing and the way that your central nervous system processes the pain that is currently stuck in overdrive in your body. So we're not suppressing symptoms or numbing symptoms by taking nerve blockers or pain medication or super strong opioids. We're helping the nervous system recalibrate again and get out of the fight or flight response. And when the system starts to feel safe again, the alarms turn off or they turn down with this gradual increase or gradual decrease, and then you start getting moments of no pain. And then we're trying to prolong that so that there's safety built in your body. Chronic pain, on the other hand, is a very real epidemic currently, and it's not always structural. There is a huge nervous system component to this, and sometimes it's a nervous system that has been protecting you for way too long. So there's also cases of flare-ups in this that I've seen in patients where, let's take low back, hip pain, for example, going on for months on months and or years. Once they try Acu for a couple sessions and they start feeling better, their muscle is not guarding as much. I still have to remind people to take it easy and take their movement still slow because their body has used to guarding their muscles and guarding its body. So when you start all of a sudden adding new movements that your body has been resistant to for a while, your body's gonna be like, oh, that's an unsafe movement. And then we flare up, your muscles tighten again. And that's just because you're exploring, because you are feeling more relaxed and not guarded as much, but your body is still learning that these are safe movements. We just learned how to be safe in our body again. So, being slow with movements, so there's less flare ups and it's just like a nice healing trajectory instead of like bumps in the road. And yeah, I think once people start understanding what and how nervous system plays into chronic pain, the treatment strategy kind of changes completely. You're not chasing pain, you're not chasing tissue remodeling, you're not chasing making the blood stagnation go away. Like you're also not fighting the body anymore. You're starting to teach that it is safe again and just overall safety, and that's what majority of the people need. And I'm teaching that to almost every single one of my patients currently. And it isn't till they actually start practicing what I am telling them to do that they really start noticing the shifts and the differences in their body a little bit more. And I always try to tell everybody that, okay, gentle reminder, I'm not here to judge you if you're not doing them, but I know this is going to help you. So, my way of always saying it is this is a gentle reminder to continue doing what I told you, and or I'm trying to teach you to regulate your nervous system. Okay, I think I've yapped long enough. This is a good topic to talk about because I see this almost daily in my practice. If you found this helpful, please like, share, comment, and subscribe. If you've had a moment like this or a flare up, and or if you've noticed nervous system regulation with chronic pain and how it started going away, please comment your story down below. I would love to hear it. And yeah, until next week.